Hi, hello everyone. I'm Dr. Shagufta, working at Health and Hijama Clinic, Banaswari, Bangalore. Let's learn about the dangers of low BP. In my previous video, I have discussed about the dangers of high BP, its complications, risk factors, and I've also discussed about various methods which can be effective in controlling high BP naturally. If high BP can be dangerous, so is low BP. When does it become dangerously low and what are the steps to improve this condition? Let's find this out. Watch the complete video and also learn the most effective method which I would suggest to my patients for effective results to improve your low BP condition. Low blood pressure occurs when the blood pressure is much lower than normal. This means that the heart, brain and other parts of your body may not get enough blood. Normal blood pressure is mostly between 90/60 mmHg and 120/80 mmHg. Low blood pressure is also known as hypotension. Blood pressure varies from one person to another. A drop of as little as 20 mmHg can cause problems for some people. There are different types and causes of low blood pressure. Severe hypotension can be caused by sudden loss of blood, severe infection, heart attack, or severe allergic reaction, also known as anaphylaxis. Orthostatic hypotension means your blood pressure drops when you shift from lying down to standing. This type of low blood pressure usually lasts only a few seconds or minutes. If this type of low blood pressure occurs after eating, this is called postprandial orthostatic hypotension. This type most often affects older adults, those with high blood pressure and people with Parkinson's disease. Neurally mediated hypotension most often affects young adults and children. It can occur when a person has been standing for a long time. Children usually outgrow this type of hypotension. Certain medicines and substances can lead to low blood pressure, including alcohol, anti-anxiety medicines, certain antidepressants, diuretics, heart medicines, including those used to treat high blood pressure, and coronary artery disease, medicines used for surgery, and painkillers. Other causes of low BP include nerve damage from diabetes or other disorders, changes in heart rhythm also known as arrhythmias, not drinking enough fluids which cause dehydration, and heart failure. Symptoms of low blood pressure may include blurry vision, confusion, dizziness, fainting, also known as syncope, lightheadedness, nausea or vomiting, sleepiness and weakness. The doctor will examine you to determine the cause of your low blood pressure. Your vital signs, that is the temperature, pulse, rate of breathing and BP will be checked frequently. You may need to stay in the hospital for a while. The doctor will ask you few questions like what is your normal blood pressure, what medicines do you take, have you been eating and drinking normally, have you had recent illness, accident or injury, what other symptoms do you have, did you faint or become less alert, do you feel dizzy or lightheaded when standing or sitting after lying down. The following tests may be done like basic metabolic panel, blood cultures to check for infection, complete blood count or CBC, including white blood cell differential, electrocardiogram or ECG, urinalysis, X-ray of the abdomen and X-ray of the chest. Lower than normal blood pressure in a healthy person does not cause any symptoms, often does not need treatment. Otherwise, treatment depends on the cause of your low blood pressure and your symptoms. When you have symptoms from low blood pressure, sit or lie down right away, then raise your feet above your heart level. Severe hypertension caused by shock is a medical emergency. You may be given 1. Blood or other fluids through an IV needle, 2. Medicines to increase blood pressure and improve heart strength, and 3. Other medicines such as antibiotics. Treatment for low blood pressure after standing up too quickly include 1. If medicines are the cause, your doctor may change the dosage or switch you to a different medicine. Do not stop taking your medicine before talking to your doctor. 2. Your doctor may suggest drinking more fluids to treat dehydration. And 3. Wearing compression stockings can help keep blood from collecting in the legs. This keeps more blood in the upper body. People with neurally mediated hypotension should avoid triggers such as standing for a long period of time. Other treatments include drinking fluids and increasing salt in your diet. Talk to your doctor before trying these measures. In severe cases, medicines may be prescribed. Low blood pressure can usually be treated with success. Falls due to low blood pressure in older adults can lead to a broken hip or spine fracture. These injuries can reduce a person's health and ability to move about. Sudden severe drops in your blood pressure starves your blood of oxygen. This can lead to damage of your heart, brain and other organs. This type of low blood pressure can be life-threatening if not treated right away. If low blood pressure causes a person to pass out or become unconscious, then seek treatment right away. If the person is not breathing or has no pulse, begin CPR. Call your doctor right away if you have any of the following symptoms: black or maroon stools, chest pain, dizziness, lightheadedness, fainting, fever higher than 101 degree Fahrenheit, irregular heartbeat or shortness of breath. Your doctor may recommend certain steps to prevent or reduce symptoms, including 1. Drinking more fluids, 2. Getting up slowly after sitting or lying down, 3. Not drinking alcohol, 4. Not standing for a long time if you have NMH or neurally mediated hypotension, and 5. Using compression stockings so that the blood does not pool in the legs. I also get to see patients who have had low blood pressure all throughout their lives, and sometimes it is also in the family where some of their close relatives also have low blood pressure. This is normal to some people as they do not have any symptoms. So I give them Hijama or cupping therapy to bring their blood pressure readings to normal levels, because having blood pressure on the lower levels can always be risky. These people tend to pass out or have giddiness very easily. Hence, I suggest all my patients with low blood pressure to continue with the cupping therapy sessions at regular intervals to bring their blood pressure levels to normal levels, because Hijama or cupping therapy, usually dry cupping, also helps to improve your blood circulation and helps to eliminate toxins from your body. Improving blood circulation and movement of the stagnant blood helps with improving blood pressure levels considerably. I have seen patients with all age groups, even the young men and women, and sometimes the older men and women have low blood pressure issues. This is something which you will not know until your blood pressure is checked. Hence, I would like to suggest to keep your blood pressure checked often to make sure the readings are normal so that they do not go dangerously low or high, because having low levels constantly or high levels constantly can both be equally dangerous. Low blood pressure and high blood pressure most of the time do not show any signs and symptoms unless they go down or up, leading to some serious health issues. So that's it for this video. I hope my video has been helpful and informative. If you like my video, do like and share and subscribe. So until my next video, stay healthy, stay happy. Bye bye.